Hello, and welcome to Shadow Me Next, a podcast where I take you into and behind the scenes of the medical world to provide you with a deeper understanding of the human side of medicine. I'm Ashley, a physician assistant, medical editor, clinical preceptor, and the creator of Shadow Me Next. It is my pleasure to introduce you to incredible members of the healthcare field and uncover their unique stories, the joys and challenges they face, and what drives them in their careers. It's access you want and stories you need. Whether you're a pre-health student or simply curious about the healthcare field, I invite you to join me as we take a conversational and personal look into the lives and minds of leaders in medicine. I don't want you to miss a single one of these conversations, so make sure that you subscribe to this podcast, which will automatically notify you when new episodes are dropped, and follow us on Instagram and Facebook at Shadow Me Next, where we will review highlights from this conversation and where I'll give you sneak previews of our upcoming guests. When you look at someone's career from the outside, it's easy to think it was all planned from the beginning. But Dr. Kushagra Verma's path as a fellowship-trained orthopedic spine surgeon was not linear. He once thought he'd be an engineer and later imagined delivering high-risk pregnancies, and yet finally found his calling in the operating room during a pediatric spine rotation. What makes his story remarkable, though, isn't just the technical complexity of his work. It's the relationships that anchor it. From mentors who shaped his vision and students he now coaches into medicine, to the children in Africa whose lives are transformed by his volunteer surgeries, Dr. Verma reminds us that medicine is about persistence, resilience, and never taking no for an answer. We talk about the long road of training, what it means to run a practice with both purpose and sustainability, and how the power of mentorship can change not only careers, but entire communities. Please keep in mind that the content of this podcast is intended for informational and entertainment purposes only, and should not be considered as professional medical advice. The views and opinions expressed in this podcast are those of the host and guests, and do not necessarily reflect the official policy or position of any other agency, organization, employer, or company. This is Shadow Me Next with Dr. Kushagra Verma. Dr. Verma, thank you so much for joining me on Shadow Me Next today. This is going to be an absolutely fantastic conversation that I'm really motivated by because of not only what you do, but how you do it. So thanks for being here.
I appreciate it.
So let's start at the very beginning. You went to medical school at NYU. You are now a fellowship trained orthopedic spine surgeon. Is this the road that you had planned for yourself back when you were 8, 9, 10 years old?
I zigged and zagged a little bit. I think like I was a good tinkerer as a kid. I thought engineering was my way, and I did pretty well in high school, even won science fairs in engineering, and got into a good college for engineering. And then halfway through, I was like, I don't want to be an engineer. This is not for me. And so I kind of redirected and went into med school. I took a year off, did some research actually at NYU, and that's how I ended up getting into NYU, because I was there. I always tell people, it's just show up, just be there in person, and doors open up. And it kind of did that way for me. I was applying to med school there. I was doing research there. They knew me. They liked me. So I got in. And then in med school, I thought I was going to do obstetrics, actually, high-risk pregnancies. I always want to do the challenging specialties, the surgical ones. That's kind of a tough specialty for a guy to be in these days. And so I just couldn't seem to envision myself doing that. So I was a little lost at the end of third year until my last block of med school. I did pediatric orthopedics. I saw them do pediatric spine surgery. And immediately I looked at it, I was like, oh, this is the coolest surgery. This is what I want to do. Obviously, I had nothing lined up, did no research, had no letters of recommendation or anything. So I decided to take a year off, and I did research in scoliosis and pediatric spine. And it was a great year. I learned a lot. I did a lot of research. This is where I talk about mentorship was so valuable. These pretty well-known surgeons, I'm still really close with some of them. I still am texting them. They're my friends now going on, God, what was that, 2008? So how many years is that? 17 years? And it was just such a good relationship, unlike anything I'd had before that in med school, where I identify with their personalities. These were unique people that could do pretty risky surgery and be pretty calm, and it was just appealing to me. And I got into residency at Jefferson. I worked under Alex Vaquero, who was a pretty well-known spine surgeon and also, a mentor. Um, and after that, I went to UCSF for fellowship, which was more complex spine and scoliosis, some peds, some adult. And then that finished up in 2016. And then I moved to Seattle, where I was a professor for a couple of years. And in Seattle, a lot of complex surgery, but I really hated living in Seattle. So I decided to move to LA and I kind of gradually started my own practice. And now we still embody a lot of that like academic feel in our private practice. We have a research component to what we do. We publish some papers. We're, you know, pretty actively involved in outreach work. We do a yearly trip to, maybe not every year, to Africa for charity where I do free scoliosis surgery in Africa. If anyone's interested in donating or supporting that cause, they can definitely reach out to us. Um, and I even like, recruit my other spine surgeon friends to go with me. And then, our entire practice, we don't really hire on Indeed. I don't hire traditional MAs. I hire people out of college that are applying to PA school or med school because I really want to mentor people. And for me, mentoring is a lot of chasing them around. Did you get your application done yet? Like coaching them. I don't know how much mentoring is happening, how much harassment is happening, but you need a little push along the way. You got to get your application done. You got to check that box. You got to take that test. It's a lot of stuff. I remember it being like just so tedious. And I remember there was a student that I mentored, a young attending in Seattle. His name's Casey. And he was a med student. They told him he couldn't get into orthopedics. And I said, well, I'll take no for an answer. And he did a bunch of research, wrote like 15 papers. He got into orthopedic residency. We stayed friends. Then I encouraged him to do his fellowship down here in Orange County. And then they loved him there. Then he stayed on. And now basically we're practicing 15 miles away from each other.
Whoa.
Yeah, it's a cool story. And he's going to go with me to Africa next year. So these relationships in healthcare I think, are special. And the mentor-mentee relationship is what keeps you going because healthcare is a little bit of a mess in this country. And you genuinely want to help people, but then the system's a little broken and long. If it's med school, God, it's so long. And I'll be very honest, I have some trauma from some of the parts of training. It wasn't really that good for your brain or your body or your health to be up that many hours working, didn't go to the gym or eat healthy. All of those things I kind of look back, I'm like, well, now I'm going to be even more healthy than I might have been because of that. And I think it's just really valuable. Like, it's one of the reasons I signed up to do this podcast right away. I was like, oh, this is perfect for me.
We appreciate it because I think your story is just, it's so full. It's so full. And it's so important to me for pre-health students to hear that once you're in medicine, it doesn't stop there. It just expands. Honestly, it grows. Things just grow. And I love how you were describing relationships because you talked about mentoring and about access and about those personal relationships in medicine. But you also talk about research, a lot of research. And that's a relationship with the capital M part of medicine. And these are the things that we love so much. And these are the things that it's why we continue to do what we do. We love people. We love forming those relationships with them. And then we also love the science behind it. We love the research. We love fixing things and solving problems and identifying those mysteries. So that was just such a great introduction. I am excited to talk about your research. I am excited to talk about your relationship with teaching and how it has brought in a PA to your practice, which is just, it sounds so fantastic, the way that you two work together. And I really, really want to talk about your charity work in Africa because, well, for any students listening, I was a student at one point and I thought that it was what I was going to do with medicine, right? Is I was going to take the medicine I learned and just change the world. And you're doing that in a very, very realistic way. So we're getting to all that. I can't wait to talk about it, but let's just talk about a day in your life, which I'm sure is very multifaceted.
It depends on the day. Every day is a little different.
Yes.
Our surgery days, we get up. I usually start my day at 5 in the morning, lift weights and exercise and get to the OR. And then, depending on the day, like yesterday, we had a huge revision, thoracic floor to pelvis revision, taking out hardware, putting in hardware, 2 liter blood loss, 5 hour surgery. That's one type of day. Sometimes we're doing, small procedures, outpatient surgery. The majority of what I tend to do on a daily basis is kind of those kinds of cases. Patients do well. And in spine surgery, there's a really big revolution that's happening where a lot of traditional spine surgery is being improved upon to the point that it's being done at surgery centers. It's being done outpatient. And it's not crap surgery, it's good surgery that's being done with small incisions. I'm always against, doing outpatient surgery where the surgery you're doing is kind of lousy. But this is actually really good surgery with short recovery times, great looking x-rays, improvement in the patient experience. So I'm interested in that side of it. And in the last 5 years, it's really been more about taking cases to the outpatient setting. Other days, it's a lot of talking. I don't mind doing this podcast because I probably, on like a Wednesday, I've spent 8 hours talking and listening, I hope. But I do a lot of consultations with patients. I ask them what's going on, and I do a lot of teaching. We have 65-inch TVs in our office. I pull up the imaging. I say, look, this is the problem. This is not going to get better with an injection, or maybe it will, or, we have medication, or this is a diagnosis, and this is what the x-ray shows. And we do it over and over and over. And that's how I end up teaching my staff. If they're interested in spine, just a few days in my office, they'll learn how to read MRIs, x-rays, examine people, talk to them, even know what the different surgeries are, because it's pretty repetitive. And then there's about a day a week that I spend doing administrative work. I'm more involved, I think, than I've been in the past, where I have marketers help, make sure people know about our practice, but I'll go out with the marketer and make sure they know the doctor's available sometimes. I will do various billing meetings to see what's happening with billing and insurance and collections. I'll meet with my bookkeeper. I'll meet with my staff. I'll meet with Calvin. There's lots of things that we sort of are kind of on the to-do list, as I say. Well, we'll put it on the list. And we have an administrative day. We tackle the list pretty systematically, and that's how we're able to drive the practice forward. We have 4 offices now. We have, this outreach trip that we're doing. We have research that we're still involved with. We're mentoring students. Like all of that sort of falls into that administrative time.
Administrative things. Thank you so much for describing that, because that's not something we really talk about a lot on the show. And I think that it's so important for not just pre-health students, but also for patients to hear and to understand that, especially in private practice, it is a business. And I think we say that a lot in terms of making money and making financial decisions, but it's also running the business that we can continue seeing our patients. And
people think running a business is like a bad word, like you're trying to make money off people. And I always want them to understand that I have almost run this practice into the ground a couple of times because I help everyone that comes in the door and not pay attention to the numbers or what's happening. And then you start looking at what actually came in and you're like, oh my God, we almost went bankrupt. We didn't collect anything. And so if you care about your patients and your practice and how you practice as a doctor or PA, you should care about the engine, which is the practice. And I think it's important. And it's made me a better doctor because for a while we were running like a factory, just try to do as many patients as possible, many consults as possible. Sometimes you're seeing too many patients and it doesn't really give you that excellent patient experience as a clinician or PA. You're not loving the experience of seeing patients like that. And so we actually slow it down. We really systematically look, we're going to do 30% of our work is going to be charity work where who cares if we get paid or not. We're going to do a certain percentage of hopefully cases where we do expect there to be some profit, and then we're going to also have clinic, and a lot of our clinic, it's not really profitable, but we want to make sure we do well enough on the surgeries that I can spend an hour and just chit chat with somebody if I need to, who's anxious about surgery. That makes me a better doctor. But if we're so constricted, trying to just see as many patients as possible, then it ultimately erodes your reputation, I think.
I want to talk about your Wednesdays real fast. Talking and listening a lot happens on Wednesdays. You perform these complex spine surgeries, and they can be life changing for patients, I'm sure, but they're also intimidating. How do you approach those conversations with people who are maybe very, very anxious about surgery? So this is the talking element of your Wednesday. What do you say to them? How do you give them comfort or reassurance?
Um, sometimes people are anxious and there's nothing you can really do. They have to just take time to process it and come to peace with it. So I usually give them the information in small doses. Like I'll say, "Oh, listen, this is going to be surgical. It's probably going to be something big. Let's have you come back with a family member. I want to go into some detail." Other times it's something small, like, "Hey, this is not going to be a big surgery. It's going to be an outpatient procedure." Most of the time, when people are anxious, it's reassuring for them to know that, listen, plan A is going to be to avoid surgery, and we're going to do this, this, and this to try. But if it doesn't work out, plan B is a minimally invasive outpatient surgery, and it's not something very technically challenging. And I can show you on a model here what I do. They actually are less anxious. Every patient has my cell phone number, at least the surgical patients. So I'm having a lot of phone calls with people afterwards. And then we never take anyone to surgery until they've had sufficient time to ask their questions,
Mm.
come to peace with it, unless it's like a real emergency, and that happens sometimes. Um, but we really, and we create a lot of content. If people are interested, they can follow us on Instagram, Advanced Spine Care, ASC.MD. They can also go to our website. And we even have our own Spotify podcast. But I create a lot of content to help relieve some of that anxiety that I know people feel. And I think information helps. But on the flip side, sometimes more information doesn't help. If you were afraid of flying and you had to sit down in the cockpit with the pilot and go over all the switches, I'm not sure it would make it better. And now they'd say, go in the back, have your cocktail,
Yep.
relax.
Yep.
So we try to strike a balance between those two. I answer the questions that they want answered and in a lot of detail. But sometimes if I feel like they're getting more and more anxious, I tell them to just, take a little break, and I let them know the difference between the complex spine surgery, the dicey stuff,
Hmm.
versus the not dicey stuff. And I'll let them know, okay, this one's a more risky surgery. These are the risks. This is my experience, and we'll have longer, more detailed conversations with those patients. You just got to be you. Yeah, talk to people. Yeah, tell them what you know how to do. Tell them their experience, and that trust will come, I think, with time. Sometimes they're not ready to hear what you have to say.
I love that you give them the education, but then you also give them the time and the space to process that, which is so important. Okay, that's the talking element of Wednesdays. Now the listening element, and this is something that you've emphasized is giving patients a strong voice in their treatment plans. And I'm sure. I mean, how often do you hear surgeons doing that? Right? That seems very unique. Tell me a little bit about that.
People with spine problems, when they're really complex, they have the same disability scores as people with terminal cancer.
Whoa.
And their quality of life is affected in such a severe way. And in certain cases, we can take a disabled patient and make them not disabled. But sometimes it's a huge surgery. Other times, we can take somebody in severe pain and with a relatively small surgery, completely change their life. But I have to figure out where they are a little bit. I want to figure out, is it pain that bothers you every day, keeps you from doing things I like to do? Is it intolerable? Is it keeping you from work? Is it pain, it doesn't get better with any non-surgical treatment? You have to really feel like you know and understand your surgeon, get to know them, and you really have to understand the surgery. And I mean, that means you really get it. Okay, the bone has slipped out of place. There's no way an injection is going to move it back into place. They got to look at the imaging themselves. They got to look at a model. They got to really see it. And then when all of those pieces come together, they can kind of make the decision, I think. Usually I give people a bunch of information and they probably feel like they're drinking from a fire hose. They're overwhelmed. They go home. And sometimes patients are like, "Well, thanks for the information, doc. I'm not ready." I'm always like, "That's fine. Take your time." And then like a month later they'll call me and they'll be like, "We're ready now." And they have to go through whatever process they're going through uh to feel like they're there. And I think, I'm half psychiatrist because of that.
Hmm.
No two people are exactly the same.
No, which is the beauty of medicine, but it's also the huge challenge of medicine. For sure. I love listening to how you're educating your patients and you're allowing them that, like I said, that space to really understand and learn and appreciate their condition and what you're trying to do. Your love for teaching obviously doesn't just stop with your patients. You've already mentioned that you employ these incredible pre-health students who are looking towards becoming physicians, PAs, and other members of the healthcare field. You love to teach. You brought on a PA into your practice. Tell me how that has been, because I think so often when we bring in another a physician, it's a colleague. When we bring in a PA, it's also a colleague. But at the same time, as a PA, speaking as a PA, I am expecting my supervising physician to be a teacher first and then a colleague second. Is that your experience?
Yeah, I mean, a lot of teaching is just done by observation. You just spend time with me and eventually just all like, I vomit out all the information I have that I've picked up over the years and you sort of absorb it. Um, and so I think, just being in clinic, being in surgery, you just get it. But in the beginning, I had a PA before Calvin who moved to Hawaii and he just told me he felt so overwhelmed in the beginning. And I said, well, that's okay. You feel overwhelmed. And then in surgery, he told me that he felt like everything was moving in fast forward, that he would go to do something and I'd already done 10 steps in that amount of time. And he couldn't understand why I was moving so fast. And I tried to explain to him, I was like, I've done this so much that there is so much muscle memory in what I do. And I know when the dicey parts of the case are, you don't know that. I know that we're just exposing the muscle off the spine. We can go as fast as we want. But then other times I know to sort of push your hand away and say, okay, let me do this.
Mm-hmm.
This is the dicey part. And that just comes from watching. I have watched a decade of surgery before I even really did surgery. And I used to hate it, to be honest. I remember being like a med student and a resident and even a fellow. I did a lot of watching. And I remember being like, man, I just want to do the surgery. And then now that I'm on the other side and been operating for 10 years, I love to watch people because you'd be surprised. The more you watch, the better you get. You
Mm-hmm.
sort of watch somebody who's really good, maybe when you're a trainee, and then you have that memory. If you watch them enough, you have it imprinted in your brain how they did the surgery, and then magically your hands just recreate it 5 years later. And it's true. I remember my first year as attending. It was in Seattle. I'm operating. Someone gave me the opportunity to see another surgeon who was in private practice, 15 years, huge volume of surgery. I spent the day with him. He just casually was like, yeah, we've got 10 cases. And I'm like, what, 10 cases? And I watched him just blow through these cases with so much efficiency and grace. And I was a first year surgeon then. And I think I came home the next day and I was 30% faster. Just
Oh,
watching him that
wow.
one day, I was just like, what am I doing in surgery? Why is this taking me so long? And I think it's like that as a PA too. I tell the PA, this is going to take years for you to feel comfortable. And that's okay.
There's nothing wrong with that. And that's why I love so much working with a supervising physician, because there are still things I encounter and I think, well, this is what I'm thinking, but I know there's something else there that I'm not thinking. So I'm going to run it by you to see what you have to say. And of course, that's clinic OR. You're absolutely right. There, he still surprises me with things in the OR, which is, oh, it's just so much fun. And I am absolutely swiping your phrase. The more you watch, the better you get. Because I mean, this is Shadow Me Next. This is a podcast directed at people to just listen and watch and understand and learn about variety of areas in medicine. And it's so true. The better you get, the more understanding you have. And
I have
that
all
was
these
great.
moves and tricks where people will ask me, how did you learn how to do this? And I like flash back to the 2016, me in Africa doing a case on a kid with a 150-degree curve. And I'm like, blotchy or whatever it is, whoever the attending was that I just stared at, watched them put it together. And it's true. It's definitely like that in surgery, specifically spine. Sometimes it's like you're putting together an erector set of
Mm.
screws and rods and hooks, especially some of the complex stuff. from a brain stimulation standpoint, I don't think there's anything better than complex spine. It just really activates a part of your brain that likes to solve problems,
Mhm.
three-dimensional problems. And if you're mechanically inclined, like I've always been, because I'm an engineer, love to put screws and rods and hooks together. I mean, it's like playing Legos.
I was
So,
thinking that as you were talking. That's fabulous. No, it's the ultimate puzzle. I am so glad that you mentioned Africa. Let's talk about that. Volunteerism in medicine is something that I think people just have such incredible feelings about and they're so hopeful about, but oftentimes they get drawn into their careers and their current lives and the burnout that's occurring right now in medicine and et cetera and et cetera. Tell us about what you're doing in Africa, and then how did you first get involved and what are the next steps with this? I'd love to hear this story.
oh, sure. I went to Africa as a med student. I was doing research, like I said, and there was a surgeon that gave a talk at a conference about doing charity surgery in West Africa at the Focus Hospital, Professor Balachi. And I ran right up to him after his talk. I said, "Please take me with you." And he's like, "Sure."
Oh,
I
wow.
did a little Facebook fundraiser, covered my flight, subletted my apartment out, and there I was with him. And I didn't do any operating or anything like that, but I helped out a little bit in clinic. It's a great experience for me. Cemented in my mind, okay, this is the type of surgeon I'm going to be. It was a long way from it, but I knew that's what I wanted. And then I kept going back. I went back in residency, I went back in fellowship, organized my own trips, same hospital. And then I've done some different volunteer trips with other people, and I've gotten some different experiences, like different countries. It's kind of like traveling and the value of traveling, but like applied to your career. You know, it makes you a little bit more resilient surgeon, I think. It makes you a little more adaptable to different situations, a little bit more resistant to stress in the operating room because you've been in some other situations that are a little wild. You know, I've been in the operating room where the power went out and everything stopped working.
Oh my God.
I've been in the city, you know, where we didn't have enough screws to put in the spine certain places. One of the reasons I like Africa is it's, even though it's an outreach hospital, the focus hospital, it's the quality of what we do is really high. And we're able to produce data, research, publish. And so I think that's very appealing for surgeons. We don't want to go somewhere and then maybe do a controversial surgery, bad outcome, something like that. It wouldn't sit well with us. So I trust this place and I've been very loyal to it as a result. And then for many years, I would sort of go on trips that were organized and funded by a third party, maybe by industry or by another surgeon. And this is the first year I'm organizing and funding the trip myself, getting the surgeons together, getting the money to the hospital, booking the flights, hotels, everything. I mean, and it's a lot more gratifying. I think, you know, I'm leading the whole thing. And I'm bringing my surgeon friends. A couple of them are pretty affluent and interested in this, and I'm excited to do it. You know, and the cases we do are very extreme. You know, probably some of the most extreme pathology in the world,
Wow.
and it's great to be there. And the surgeons there are really good now. Over the years, they're not surgeons that need a lot of training, but there's a collaboration there that I think is really valuable and fun. So hopefully I get to continue to do it. But I remember when I moved to LA, I was with a group and I was talking about doing outreach work, and they just couldn't understand why I would do outreach work. And that was like the first motivation for me to start my own practice. Like, no, we've got to have a practice where we could do whatever we want. And then there was a year where we were like just dying financially. You know, our billing was kind of a mess, and I did not go on my outreach trip.
Mm.
And that was the motivation to be like, you know what? I need to make sure I get a handle on the administrative side and the financial side of this practice so that I can do the research, so that I can pay my PA and med students well and have them not be overworked, so that I can do the charity work. So if you're feeling bogged down with the administrative side, I'd say, listen, this is what gives you the freedom to practice medicine the way you want, is taking the bull by the horns.
We work so hard for what we do, and then you take that success and you pour it right back in to more success in just a little bit of a different way. I mean, correcting pediatric spinal deformities for children in Africa, it's just the
It's so
coolest
cool.
thing.
I remember I went on a trip with another surgeon, Tony Ranella, and he was giving a speech, and he said it so simply. He said, "This is the best thing that I do." And that's exactly how I feel. I don't know that I do anything that's better than this.
You have built and established and continue to succeed in this private practice. You host students, you teach, you've published over 50 peer review articles now. I mean, you travel to Africa and improve the lives of children. It's just fantastic to hear of these incredible success stories.
I didn't do any of it alone. Every paper had multiple co-authors on it, you know. I think being collaborative has always helped me. You know, there's a million spine surgeons in town. I try to make friends with all of them because I think I said this on another podcast, is every surgeon's a little better at something. You know, somebody might have a little better skill set at minimally invasive. Somebody might be a little bit of a better deformity surgeon. For a long time, everyone was a better businessman than me. You know, and making friends with people in your specialty makes you better. The relationships, your career, I think, is more resilient to being killed by burnout, let's say, if you've got friends in what you do, right? Like,
it's relationships. It's like we talked about at the beginning. You know, you started this career in a relationship as a research undergrad student, and then you said, "Take me with you," and that's how you ended up in Africa. And it's just, relationships are so important. Mentorships are so important. So Dr. Verma and I did not have a chance to discuss a quality question, but he's about to give us some really great feedback that would make a perfect interview question. And that question would be, tell me about a time you faced a setback in your academic or clinical journey. How did that push you forward? And what did you learn about yourself in the process? Let's see how Dr. Verma poses and answers this question. Keep in mind that there's more interview prep, such as mock interviews and personal statement review, over on shadowmenext.com. There you'll find amazing resources to help you as you prepare to answer your own quality questions.
I want to give you a few words of motivation. I was not the best student. It was not all smooth sailing for me. There were a lot of roadblocks, you know. I didn't get into med school my first try. I had to retake my MCAT. I'm not a good test taker. In residency, it wasn't clear I would get into the fellowship I wanted. It wasn't clear I would get into the residency I wanted because I didn't have the best test scores. You just have to keep going. You have to never take no for an answer. If it's something you really want with your career, you have to say, well, this is what I'm going to do. And eventually the doors will open. The people around you will just be like, okay, well, he's not going to go anywhere. He's going to do this. And I think that's really true. I think I ended up here because I had a really clear vision in med school finally, like, this is exactly what I want to do. And there was nothing that could shake me from that. And so I think that's the most important thing for young people. They can get bogged down by the work, the rejection, the letters of recommendation, the expense. There's a lot of barriers. But if you just never take no for an answer, you will end up where you want to be. Maybe not the path you thought you'd take, but you will end up there. Not everyone's going to open the door up for you right away. And so for everyone out there, just stay motivated. I used to listen to motivational videos on YouTube in med school because I was down in the dumps my second year of med school, studying all the time, not doing well on tests. So, try to stay motivated, stay positive.
Resilience and tenacity. They are two things that are so undervalued and just absolutely so important. Oh, Dr. Verma, thank you so much. I appreciate you joining us tonight on Shadow Me Next.
Absolutely. If anybody wants to learn more, advanced spine care, you can come check us out on our website. asc.md is our Instagram. And you can also call our office if you're in the Southern California area, 562-732-4578. It was great chatting with you.
You too. Thank you so much.
My pleasure.
Thank you so very much for listening to this episode of Shadow Me Next. If you liked this episode, or if you think it could be useful for a friend, please subscribe and invite them to join us next Monday. As always, if you have any questions, let me know on Facebook or Instagram. Access you want, stories you need. You're always invited to Shadow Me Next.